You know, for billions of people all over the world, there's a virus living inside them that they will probably never, ever know about. It's kind of like a silent companion, a little souvenir from an infection that came and went without any fuss. But for some people, this exact same virus is a hidden threat, a sleeping giant that can wake up with absolutely devastating consequences. Today, we're talking about cytomegalovirus.
All right, let's just jump right in with a number that might just blow your mind, 83%. So what on earth does that represent?
That is the estimated slice of the entire world population that has antibodies to CMV. What that means is they've been infected at some point in their lives. The vast majority of us are just walking around with this virus as a lifelong passenger. Seriously, if you're watching this with a couple of friends, the odds are most of you have it. It is truly one of the most successful viruses on the entire planet.
And this map really drives that point home. You can see just how widespread this silent companion is. I mean, the prevalence is high pretty much everywhere, but especially in places like the Eastern Mediterranean, Africa, and Southeast Asia. In some of those areas, it can climb over 90%. This thing is truly global.
So what exactly is this virus that so many of us are carrying around? Let's, get a closer look at the virus itself.
Well, CMV is a member of the herpes virus family. That's the same family that includes the viruses that cause things like chickenpox and cold sores. And just like its famous cousins, once you get CMV, you've got it for life. The virus goes into this dormant or latent state, where it just kind of hides out in specific cells deep inside your bone marrow.
And part of the reason it's so incredibly common is because it spreads so easily. It's passed through direct contact with bodily fluids. I mean, this can happen through something as simple as a little kid sharing a toy that's covered in saliva, or through more direct routes like sexual contact, blood transfusions, or even from a mother to her baby during pregnancy or through breastfeeding.
Now, here's the key thing. For the vast majority of people who have a healthy immune system, getting CMV is really no big deal. You might not have any symptoms at all, or, you might feel a little crummy like you've got a mild case of the flu or mono. Your immune system's special forces, your T cells, they swoop in, get the virus under control, and force it into that quiet, latent state where it just hangs out for the rest of your life.
So, this brings us to the big question, right? If more than 80% of us have this virus, and it's usually totally harmless, why are we even doing this explainer? Why is this such a major focus for medical research and a huge concern for doctors?
The answer is all about what happens when that delicate balance, that truce between the virus and our immune system, gets broken. Because for certain groups of people, CMV isn't a silent companion at all. It's a life-threatening invader.
And this slide, wow, it really lays out the two completely different faces of CMV. On the left, that's the typical story for a healthy person. But on the right, that's what can happen when someone's immune system is compromised. The latent virus can suddenly reactivate, start copying itself like crazy, and lead to this severe tissue-invasive disease that can damage pretty much any organ in the body. It's like night and day.
So who are we talking about? Well, the highest risk groups are people whose immune systems are either not fully developed or are being suppressed. This includes organ and stem cell transplant recipients. They have to take drugs to prevent rejection. It also includes people with advanced HIV/AIDS and patients going through chemotherapy. And critically, it includes unborn babies, because CMV is actually the most common infectious cause of birth defects.
Okay, so how do doctors actually find and manage this hidden threat before it gets totally out of control? Well, it all starts with being able to tell the difference between just carrying the virus and being actively sick from it. And to do that, you need some very precise language.
So according to the big international guidelines, there's a crucial difference here. CMV infection just means the virus is awake and making copies of itself. You can detect it. CMV disease, on the other hand, means you've got the infection and you have symptoms that are actually caused by it. This distinction is absolutely critical because it tells a doctor whether they need to jump in with treatment or just keep a really close eye on things.
And when doctors are looking for that active virus in the blood, they use a specific term, DNAmia. Now, you might have heard of viremia, which just means virus in the blood. But DNAmia is way more accurate here, because the modern tests aren't looking for the whole virus particle itself. They're actually detecting its DNA, its genetic fingerprint.
The gold standard test for this is something called QNAT. It stands for Quantitative Nucleic Acid Amplification Testing. It's a super sensitive test that doesn't just give you a yes or no answer. It actually quantifies how much viral DNA is in a blood sample. This viral load gives doctors a precise number they can track over time, which is just essential for managing this virus. All right, let's focus in on the group where CMV causes the most problems: transplant recipients. In the transplant community, CMV is so notorious for causing trouble that experts have even given it a nickname, the transplantation troll.
So doctors have two main playbooks for keeping this troll under the bridge. The first is called universal prophylaxis. This is where all the high-risk patients get an antiviral drug for a few months right after their transplant, just to be safe. The second strategy is preemptive therapy. Here, nobody gets the drug at first. Instead, everyone is monitored with frequent viral load tests, and treatment only kicks in if that number starts to climb.
And when treatment is needed, it's a really delicate balancing act. The goal isn't to get rid of the virus forever. That's impossible. It's to suppress it, to beat it back down until the patient's own immune system can recover enough to take over again. And this whole field is changing fast, with newer drugs like letermovir and maribavir that are not just more effective, but also have fewer side effects, which is a total game changer for these patients.
And the stakes here are just incredibly high. Uncontrolled CMV can attack almost any part of the body. It can cause pneumonia in the lungs, severe inflammation in the colon, vision loss, hepatitis in the liver, and even brain inflammation. In transplant patients, it can actually trigger rejection of their brand new organ. And in newborns, it's a leading cause of permanent hearing loss. This is why doctors are so vigilant.
So, after all of that, what's the big takeaway? Well, CMV is just a masterclass in the incredibly complex dance between a virus and our own immune system. It perfectly illustrates how the exact same virus can be a totally harmless passenger in one person and a deadly enemy in another.
This quote from the top experts, it really says it all. Decades after we first discovered it, this incredibly common virus, this silent companion for most of us, is still a huge challenge in modern medicine. It's a transplantation troll that doctors have to constantly outsmart to save lives. And it's a powerful reminder that in the world of viruses, the real battlefield is often our own immune system, and the outcome depends entirely on its strength.